Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Coarctation of the aorta in terms of the pregnancy. So what are the important points to note here? Any anesthetic procedure that causes hypotension should be avoided. So any procedure causing hypotension. So in case it causes hypotension, what you simply do is you avoid it. So you avoid. Next is the regional anesthetic procedure. So what is the regional anesthetic procedure? So the regional anesthetic procedure such as a spinal anesthesia. So regional anesthetic procedure such as a spinal anesthesia and the epidural anesthesia should be avoided. So spinal anesthesia as well as the epidural anesthesia. So spinal anesthesia, epidural anesthesia, they should be avoided. Next is moving on. The general anesthesia is the treatment of choice. So GA is nothing but the treatment of choice, TOC. To learn and grow daily like this, please do subscribe.